Yeah, it looks like we were able to deliver on that 90-second promise. Our next presenter is presenting the state of the ticks in New York State, not the state of the state, but the state of the ticks in New York State. And she comes to us from the New York State Health Department. So on surveillance and outreach statewide, when it comes to ticks, let's welcome Jennifer White from the State Department of Health.
Good morning, everyone. So yes, I'm Jennifer White. I'm the director of the Vector-Borne Disease Program at the New York State Department of Health. And exactly as Dan just said, today I'm going to do a little bit about the state of the ticks in New York State, including what we're doing by way of surveillance and outreach. If I can make an advance. There we go. So for those of you who are not aware, there are about 30 species of ticks in New York State. 10 of those will commonly bite humans, but to date, we only have about 4 that can potentially transmit diseases. Again, we're just keeping this specific to New York State. So the deer tick, and again, you've heard a lot of this information before, and some of this may be familiar to all of you, but this will be very brief. The American dog tick, the Lone Star tick, and the woodchuck or the groundhog tick. As far as tick-borne disease transmission goes, you can see some of these diseases that are commonly carried by the different ticks that I'm listing here. Again, not going to belabor this point. But obviously the tick that we're most concerned about in New York State is the black-legged tick or the deer tick. And that's because that disease can transmit multiple different pathogens and cause quite a bit of disease and morbidity and mortality among New York State residents. So that tick obviously carries the bacterium that can cause Lyme disease, which is by far our most common tick-borne disease in New York State. But the tick can also carry the bacteria that cause human granulocytic anaplasmosis. The tick can carry the parasite that causes babesiosis and also deer tick virus. This is lineage 2 Powassan, which I know Dr. Thangamani had referred to before. And also Borrelia miyamotoi as well, though the State Health Department currently does not do human surveillance for Borrelia miyamotoi. So I will try if I can. I do have a little graphic on the bottom. There it goes. Maybe I can get that to play. So this shows the Lyme disease rate from 2016 to 2020. And you can see that the rate in New York State does change over time. What's important to note for the next upcoming slide series is that these are cases that are identified by the county of residence, so not necessarily where exposure occurred. For Lyme disease, exposure can occur in any county in New York State. So anywhere you live in New York State, you can be exposed to ticks that carry Lyme disease. So we definitely do see endemicity statewide for this one. And again, rates change over time. It's also important to note on this slide that this data is based on the National Surveillance Case Definition for Lyme disease. So that's sort of a definition that epidemiologists and public health professionals use across the country so that our surveillance practices and the case numbers that we wind up reporting are similar. As far as tick-borne diseases go, Lyme disease is probably the least similar when you're making comparisons across states. And that's predominantly because states have had to come up with their own ways of managing the burden of surveillance when it comes to Lyme disease. If our local health departments in New York State's a home rule state, so our local health departments investigate cases of Lyme. If they were to investigate every case of Lyme, which involves reviewing lab results and also getting clinical information to back those up, it would really hinder their ability to do any other public health activities or be able to do prevention efforts for Lyme. So up until 2022, the New York State Department of Health was using a surveillance sampling mechanism and basically extrapolating. So we were only looking at a 20% sample of positive lab results and then doing the clinical investigation piece on those. Other states were doing just laboratory only surveillance. Some others were doing different sampling methods. So if you look at CDC data, it actually won't look the same as what we report on New York State's website. And that's important for all of you to know if any of you are using surveillance data for research purposes. And that's because that sort of sampling mechanism that we did, or some of these alternate surveillance methodologies, were never formally adopted, though they were supported by CDC. So their numbers are sort of our raw numbers. So New York State Department of Health's website includes what we would consider to be our Lyme disease case numbers each year, though we know they're an underestimate. And along those lines, in 2022, a new national surveillance case definition was adopted. And now all high incidence states in the country, including New York, are just doing laboratory only surveillance. So a positive lab result that meets two-tiered testing criteria meets a case definition for a probable case of Lyme disease. And similarly, any physician reported cases would be included in our total as well. So just a cautionary tale moving forward about comparing across states and also comparing New York State numbers. When you get past 2021, our 2022 numbers are actually going to look a lot higher. And we're getting a lot of media requests these days wondering why that is. And it actually has little to do with tick-borne disease transmission and much more to do with the way that we're counting cases from a public health standpoint. See if I can go to the next slide. It just wants to play this one again. There we go. So there's babesiosis. Let's see if I can get this one to play. So similarly, as I had mentioned with Lyme, here's our babesiosis. I did these sort of in alphabetical order. This is actually our third highest incidence tick-borne disease in New York State. Anaplasmosis is second. You can see that babesiosis is still relatively uncommon in the western part of New York State, but certainly more common in the Hudson Valley up through the Capital District region and also in central New York. Human monocytic ehrlichiosis, again, not transmitted by the deer tick in this case. And this is a relatively rare tick-borne disease for us to find in New York State. And when we do, it's predominantly among individuals in the lower Hudson Valley. The graph makes it a little hard to tell, or the graphic, because it makes it look like it's a very high incidence. It's just high compared to the other areas, but it's a relatively low incidence disease in New York State. And Rocky Mountain spotted fever. Rocky Mountain spotted fever is even more rare than human monocytic ehrlichiosis among New York State residents. It's something we don't see a lot of, generally less than 40, 50 cases a year on average. And again, many of those are downstate, lower Hudson Valley, and Long Island. And I think I missed my anaplasmosis slide, but I'm not going to try to go back, because if I do, I think I'll mess everything up. Anyway, so I'll take a break and go back to anaplasmosis verbally. So that is our second highest incidence tick-borne disease in New York State, again, carried by the black-legged tick. And we see a lot of it in the Hudson Valley region and in the Capital District. In fact, in the Capital District, in a 5-year period, we saw a 200% increase in cases in the Capital District. And our local health departments will tell you that that is the disease that's probably keeping them the busiest in the absence of having to do individual case ascertainment for Lyme disease. And so lastly, talk a little bit about Powassan virus, which I know Saravanan did before. Oops, back. So you can see here, we have very few cases when we're talking about Powassan virus. On average, less than 10 cases a year. We're on record, though, to potentially have 10 cases this year, and we're not even through September yet. So we may find this to be sort of our first year where we're breaking that 10 case mark when it comes to Powassan virus. Most of our cases are in the Hudson Valley. Again, we do see some Powassan on Long Island as well. And over the past couple of years, we've seen an increase in Powassan cases up in northern New York. So in our counties that are closer to bordering Canada, above the Adirondack region, or at the edge of the Adirondack region, upstate. And Powassan is very interesting. We've talked in previous lecture today, or previous presentation today, about the two different lineages of Powassan virus. So we don't get a lot of data on which lineage patients are actually carrying or patients are infected with. And that's because most of our patients are not diagnosed by PCR. Most of our patients are diagnosed serologically. And when that's the case, we obviously can't tell the difference as to which type of Powassan virus we're actually experiencing or that patient's experiencing. But what we believe to be true based on the epidemiology is that most of these patients are infected with deer tick virus. When we have been able to identify the lineage during PCR testing, it has been deer tick virus that we found, with one exception, a child who was an avid woodchuck hunter with his family. But otherwise, it's actually very rare to encounter a woodchuck tick in nature. When we go out to collect woodchuck ticks, and I'm sure those of you that have done it can attest to this, it's very difficult. We basically, when we do it at the state health department, we take what what looks like a giant Q-tip and we swab the inside of woodchuck dens to try to collect those particular ticks. And so it's not something, though, that you're not as likely to encounter them when you're out taking a walk the same way you are as you're likely to encounter a deer tick. So we believe most of our cases are deer tick virus. Another sort of piece of evidence that supports that is there have been a number of Powassan lineage 2 people who have also been co-infected with something like Lyme disease. Again, sort of lending that support to the fact that these are likely deer tick virus cases. So talking a little bit about what we do for pathogen surveillance in New York State. I talked a little bit about humans already. We also have an active tick surveillance program that we've been working on since 2008. And this surveillance program involves standardized dragging and flagging surveys. For those of you who are not familiar with tick collections, we basically take a piece of muslin cloth like shown in this photograph, and we drag it over grassy edges, woody edges of properties, and try to collect ticks. And whatever we find on the drag or flag, we take off and we bring back to the lab for identification and for testing. So the testing that we perform is for actually 6 different pathogens. We test ticks that come back to the lab. We're looking predominantly for deer ticks or black-legged ticks. And we test for the bacteria that causes Lyme disease, anaplasmosis, babesiosis, Borrelia miyamotoi, and we test for Powassan virus as well. So it's individual ticks that are done for the quadplex, which is the Lyme, Babesia, Anaplasma, and Borrelia. And then we do pooled testing for Powassan virus through our arbovirus lab. So the way we do these surveys is that we try to sample in every county and every location annually, but some that are more remote are done rotationally. And obviously we have a little bit of lack of data for some parts of, during the pandemic where we were not able to go out and collect ticks at times as a team. We try not to send our people out in the field alone. And when we were on lockdown, that didn't happen. But otherwise, we have a really robust data set that goes back to 2008. So from 2008 to 2016, every county was sampled during that time frame. And we collect up to 50 ticks per life stage, per location, focusing on nymphal and adult ticks. And so in that window of time, we collected about 71,000 ticks. And results were then shared with local health departments, state agencies, medical providers, veterinarians, and the general public. Local health departments usually tend to use this information to be able to flag sort of hot spots or areas that they consider might be high risk. And I'll talk a little bit later in this presentation about some of the targeted messaging that they do. So now looking forward to the last several years, and we're talking here 2020 by the numbers. So in 2020 alone, we sampled 199 locations, which was 52 of 62 counties. We do not do sampling in the New York City boroughs. They have their own program and do their own sampling. So this is limited to the counties excluding New York City. We collected almost 31,000 ticks. And of those, about 19,000 were Ixodes scapularis or deer ticks. Those that were tested by the quadplex, again, the Lyme, Babesia, Anaplasma, Borrelia miyamotoi screen, about 7,100 of those, 7,100 of those were tested. And for Powassan virus, nearly 10,000. And so this data, or this chart, these two maps, it's a little bit difficult to see, I know, without zooming in. But what's been really interesting to us and actually encouraging is when we're talking about things like anaplasmosis and babesiosis, we have definitely shown that the tick data matches the human data, which is a good thing, right? Where we find infected ticks is where people are exposed and where people are reporting exposure when they're diagnosed with these tick-borne illnesses. So we really can use this tick data sort of as a sentinel for where we believe humans to be at risk for tick-borne disease. So when we do this tick testing, we actually make it public. Like I had mentioned before, we definitely provide it in writing to our public health partners at a very granular level. So we're able to say at X park, we found this. We provide it at a little bit less of a granular level. We provide it at county level publicly. And part of the reason we do that is because we don't sort of want the scarlet letter on particular parks, right? Tick-borne illness is a risk when you're out in New York State, but some of the parks have been proactive, state parks have been proactive, local health departments have been proactive and have put warning signs out, which I will show a graphic of in a little bit. So on this data site that I just had on the last slide, we call it Health Data NY. It provides the results from that collection and testing of those nymphal and adult deer ticks. Again, these are all ticks that are collected as part of our routine annual sampling efforts. We also go out and do collections often in response to unusual presence of disease like Rocky Mountain spotted fever in an area we haven't seen it before. We will go to Powassan case homes and occasionally do sampling and testing as well. But that data, because it's related to specific epidemiologic investigations, is not posted on the website. So this is our general overall routine surveillance, and it lets us look at trends over time because we're going to the same public lands each year. And we put that information out there to be able to educate people that there's a risk of coming in contact with ticks and tick-borne diseases, and that risk can vary depending on what county you're in and what disease we're talking about. So, caveats to this are that the data only provide infection rates for ticks at a precise location and at one point in time. These can vary over time. They can vary greatly within a small area and within a county. We have found that particularly true when it comes to Powassan virus. We have had individuals who they believe were exposed on their property, and when we've gone out on their property and collected hundreds of ticks, we haven't found another positive. Similarly, we will find one state park where we will see Powassan presence and one that's a half a mile away and we don't. It's a very interesting focal dynamic. So we always say that data shouldn't be used to broadly predict disease risk for any county, but can give you and the public a general guideline as to what you may encounter if you're spending time outdoors in these locations. So turning to education and outreach highlights, I will be showing a couple videos in the coming slides to give you an idea of some of our newer online media campaigns, including how to safely remove a tick, and a number of videos on the New York State Department of Health website that show how we go out and collect ticks. We also have done that distribution of educational materials that I mentioned. So we have these warning signs, and they're actually available for the public or any organizations to order. I know our Boy Scouts have also ordered them as well in some counties and put them up in public parks. And they give some information on, you're walking in this public park, you might be at risk of acquiring a tick-borne disease. We also have a how to safely remove a tick trifold card. And in collaboration with our New York State Education Department, a couple of years ago, we helped develop a toolkit for schools, for school nurses or public health educators, science teachers to administer to their students, and also to help guide school nurses in how to assist with either tick removal if the school district will allow it, or prompt notification to parents, and then next steps that they can provide to parents to try to prevent kids from getting sick if they have had a tick bite. We also have this new poster that we put out in collaboration with CDC. This is out within the last year or so. And we really did this because a lot of individuals have expressed the fact that, either in medical school or nursing school, they may see a picture of a bullseye rash and it looks like the Target logo, which it can look like that. But there was a lot of concern that it doesn't always look like that, right? It can look like a bruise. It can look like there can be multiple rashes. And there has been most concern that it certainly did not depict persons of color, in which case the erythema migrans rash can look quite different. So we really tried to do this as a means of helping folks identify erythema migrans rash when they see it. We want doctors to start trusting their eyes, because I know a public health nurse from one of our counties called me a couple weeks ago and said the doctor had said, I think this is an erythema migrans rash, and put this particular public health nurse on doxycycline appropriately, but did order blood work. And when the blood work came back negative, she called the public health nurse and said, discontinue the doxycycline. Now, those of you in the room know that that's not an appropriate course of action, because sometimes, during those early days of Lyme, particularly when you have an erythema migrans rash, you may test negative, but that does not mean you don't have Lyme disease. So we tried to do this to help folks understand the different spectra of what EM rash can look at. And we have these distributed through our health departments, and also have given copies to folks at the State Medical Society. But if anyone in the room is interested, they're available free of charge and in large quantities through the New York State Department of Health website as well. They're great to post in, particularly dermatology clinics have really liked this particular publication as well, and urgent cares. So prevention messaging, we've talked about this before, dressing appropriately, doing frequent tick checks. But a couple of different new messaging that we're putting out now. We had always talked about, doing the tick check when we came indoors at the end of the day. And I know Brian talked about that with his family, and my kids did the same thing until they were irritated to have to drop trow in front of each other. But, this was something that we always did as a family. And now what we're saying to our kids is, check when you're outdoors. We say this to the public as well, not just when you come in at the end of the day, but anytime that you're outdoors, be checking while you're outdoors. Powassan's really a game changer. It can be transmitted in as little as 15 minutes. So you don't want to just wait till the end of the day. You want to remove those ticks while they're crawling on your skin, crawling on your clothing before they can get to an area where you don't see. And even an hour or two delay can make Powassan transmission possible. Although it's very rare, it is something that we're concerned about. And we're also looking to put out some messaging now in relation to some of the recent cases of Powassan virus that we've had. A good case in point is a case we had within the last year of a 3-day-old infant who contracted Powassan virus. The infant was never outside. The mother found the tick upon changing the child on day 3. And they had had ticks in their home before. They had a cat that was indoor, outdoor. And those of you that have cats or know cats know that they tend to be over groomers. So if there's a tick on a cat, they will often find that tick, but the tick then found its way onto this infant. And by day 10, the infant had seizures and high fever, and fortunately is doing remarkably well. It was not one of our more severe cases, but this is the second instance that we are aware of where we believe an indoor-outdoor pet was a potential epi-link to the child contracting Powassan virus. So it's a hard message to nuance because we don't want to instill panic. Again, it's a very rare virus. This is a very rare occurrence, but knowing it can happen is important. We also talk about repellent use a lot. I will preface, I believe I'm going to have assistance with playing the video. Okay, it'll be the first one, the YouTube link. But before we started, I'll just preface it by saying that one of the things we hear the most often when we're out in the public, whether it's the state fair or one of our other public education initiatives, is that repellents don't work. I don't bother using repellents because they don't work. Or, oh, someone gave me this oil and, this is how we do it at home. So we recently created this video in collaboration with New York City Department of Health to show individuals how repellents actually are effective and the risk of using non-EPA approved repellents as well. So.
When spending time where ticks are often found, such as in wooded and brushy areas with tall grass and leaf litter, use insect repellent labeled to prevent tick bites and diseases spread by ticks, such as Lyme disease. There are many repellent products advertised, but not all are effective at repelling ticks. Be sure to check the label. Repellents containing active ingredients such as DEET, picaridin, and IR3535 are approved by the Environmental Protection Agency, EPA, and shown to be safe and effective at repelling ticks. Some products may be advertised as organic or natural. These repellents have not been evaluated by the EPA to determine their safety or effectiveness and may not repel ticks or may only work for a short period of time. Let's compare 3 products containing different active ingredients, DEET, picaridin, and an organic repellent comprised of essential oils. Each is applied to the area of a finger above the black line seen around the knuckle. Effective products should repel ticks like we see here, as black-legged ticks crawling up the finger fall off the finger as the tick approaches the line where the repellent was applied. 1 hour after application, while DEET and picaridin products repel the tick, the organic repellent does not effectively repel the tick. Even after 4 hours, the DEET and picaridin repellents remain effective against the tick, highlighting the importance of using a long-lasting EPA-registered repellent. The EPA website can be used to find products that have been evaluated to safely and effectively repel ticks. Carefully read the product's label to ensure it is effective at protecting against ticks, not just mosquitoes, and how long protection time should last. If you're spending a long time outdoors in tick habitat, you may need to reapply. Apply repellent as directed by the product's label. Permethrin is another great option for preventing ticks. You can apply permethrin to clothing, boots, and gear, or buy products pre-treated with permethrin. It is not for use on skin. Treat dogs and cats for ticks as recommended by a veterinarian. Even when using repellents, remember to do a tick check after coming indoors and remove attached ticks with pointed tip tweezers. For more information on the different types of recommended repellents and safety, visit nyc.gov/health and search for insect repellent, and visit nyc.gov/health/ticks for more information on ticks, diseases spread by ticks, and tick bite prevention.
Thank you. So I don't know how many of you had seen that before, but so far we've gotten great public response and response from the public health community and the
I'm Dr. Tom Mather, the tick guy.
YouTube's still going. And then lastly, I know Brian showed a little video before, but I'll show ours. And that wasn't my finger, by the way, with the repellent on it. All credit goes to Melissa Prusinski, who's the director of our vector ecology lab, who was brave enough to do that one afternoon. And we were really concerned because, you know, it's like working with pets. You never know how they're going to behave, but they did what they were supposed to do. So we're very happy. And so the last video that we'll show is one that we did in-house with our sort of camera crew that we think does a really good job of showing tick removal. And this features my colleague, Brian Backinson, who many of you in the room may know. And Brian got what we believe to be, and he's still here, so we believe it. They weren't lying. CDC sent what they believe to be clean ticks, right? Ticks that were lab reared. And he let them attach to his arm under some piece of gauze. And his wife, I don't know if she was willing to be too close to him while that was happening, but regardless, he did let them attach to him, and then I removed it on camera. So if you want to go ahead and show the video, that would be great.
Ticks are common in New York State, and they can carry disease, so it's important to check for ticks and to know how to promptly remove a tick if you find one attached. First, you'll need a pair of fine-tip tweezers like these. They work much better than blunt-tip tweezers or your fingers alone. You can do this yourself or ask a friend to help. Before you start, clean your tweezers with a little rubbing alcohol on a cotton ball. Now grasp the tick where the mouth is attached, which isn't always easy to see, especially on ticks the size of poppy seeds. But if you gently lift the tick with your tweezers, you can see that it's attached like a hinge. That's how you can tell where the mouth is. Get as close to your skin as possible with your tweezers. Now pull in a slow, steady, upward motion away from the skin. Don't twist, jerk, or wiggle it out. Your skin will pull up as the tick detaches, just like when you pluck a hair. Afterward, clean the bite site with rubbing alcohol and a little antibacterial cream. If the mouth parts stay in your skin, you can either leave them alone or try to remove them with tweezers, as you would a splinter. Keep an eye on the bite site for 30 days, watching for any kind of rash, including the telltale bullseye rash for Lyme disease, or for flu-like symptoms such as headaches, muscle aches, or fever. If any symptoms do develop, you'll want to see your doctor and make sure to let him or her know the date and location of the bite. Remember, not all ticks carry disease, and your risk for disease is greatly reduced if ticks are removed promptly. Knowing how to safely remove a tick can help keep you safe from tick-borne disease. Learn more at health.ny.gov/tick-free.
Cole, he's my miracle child. So
Thank you so much. And the last thing that's on my talk today is just to give you a little bit of background on the Asian longhorn tick, which is a relatively new tick in New York State. It's not normally found in the Western Hemisphere, but the ticks were first reported for the first time in the United States in 2017. In fact, we had our first identification in New York State in 2017 as well, but didn't know it until much later. It had been misidentified originally. So Asian longhorn ticks have been found on pets, livestock, wildlife, and people. What's interesting about this tick is the female tick can lay eggs and reproduce without mating. And literally thousands of ticks may be found at a time in grass or shrubs or on an animal. It's sort of fascinating if you've never seen it before. We got a video sent from a private submission, and it was a truck, and it appeared to have large spots of rust on it. But upon further look, the rust was moving, and it was large numbers of this particular tick, this Asian longhorn tick. So, oops. Can you go back? Sorry. Yep, the map. Thank you. Perfect. So as of July of this month, we'll have to move again. We'll go quick. So as of this month, Asian longhorn ticks in New York State have been found in the following counties, with identifications in Columbia and Greene County just as of this year. But we've also found the tick in Dutchess, in all the boroughs of New York City: Orange, Putnam, Rensselaer, Rockland, Suffolk, Ulster, and Westchester. But clearly this is a tick that's on the move, so it won't be long before we're seeing it in other counties as well. And compared with well-known native ticks like the black-legged tick, the Lone Star tick, and the American dog tick, Asian longhorn ticks appear to be less attracted to human skin. So one of our colleagues downstate in our field area at Fordham University showed what happened when they were holding a handful of Lone Star ticks, and they all kind of ran away as quickly as they could and jumped off. So that's good news in terms of, sort of their affinity for humans. But again, this is just, a number in a lab. And it doesn't necessarily mean that this is what we're going to see over time or what necessarily will occur in nature. I went too far. So as far as, let me go back. As far as concerns go when we're talking about the Asian longhorn tick, our primary concern right now is for livestock. It's a known serious pest of livestock in the Australasian and Western Pacific regions, and it's an aggressive biter. And what's interesting too is that it will frequently build intense infestations on domestic hosts like cattle and can cause great stress, reduce growth and production, and severe blood loss. And there can be death due to the bites of Asian longhorn ticks as well, again, because of this volume of ticks that will sort of crowd on a herd and then cause infection. And as far as concerns for human health go, research is ongoing. It's a concern here like it is in other parts of the world, although we know in other parts of the world the Asian longhorn tick can transmit disease. The jury's still out on what can happen in the United States. A recent experimental study showed that it's not likely to contribute to the spread of Lyme disease, that bacteria, which is a good thing. But a laboratory study did find that the longhorn tick could potentially carry and spread the bacteria that causes Rocky Mountain spotted fever. But again, it's not been found in nature. So this is based on laboratory studies, but something that a lot of folks are working on to sort of see how this tick could potentially impact human health in the coming months and years. So that's all I had. So I can take questions if anyone has any.
Thank you, Jennifer. We've got 2 microphones, and if nobody else has their hand up, you got Brian. We'll start here and then we'll go over to Zoom.
Jennifer, thank you. And those videos are amazing. It shows I'm not an artist or a videographer. So I really appreciate that. I wanted to add one thing, and I forgot to mention this. When we talk about the rash, right? We saw Brian had a small little rash at the site of the bite irritation. I like to say, and this is a good opportunity, is, well, how do you know it's a bullseye rash or an erythema migrans? Well, I tell people, take a Sharpie marker and draw the outer edges, trace the outer edges. If you wake up the next morning and that red ring is out beyond that Sharpie marker, that's a red expanding rash, which is what an erythema migrans is. So it's a good tool to use and tell your patients or use for your own family. I just want to take the opportunity.
And similarly, I'll bring up too that we have had individuals literally show me scars from trying to remove the mouth parts. So that's another thing that we're trying to educate people on, is you do not need to dig a giant hole in your skin to remove those the mouth parts once the body of the tick has been removed. Your risk of infection goes way down. But the lengths people will go to dig those mouth parts out with concern for tick-borne illness is a little bit concerning, honestly, and have had healthcare professionals do that to them. So something we're trying to encourage folks to know how to handle this situation. Go ahead.
There are online vendors selling tick removal tools that are
Great
more
question.
Than like
Yes.
tweezers. Do you have any comment?
So those really do depend on a number of factors, right? Some of them are better made than others in terms of their ability to get, say, under a nymphal tick and get down to the mouth parts. If they're too thick, they may only work more on an adult tick. And the other thing we always tell people is the reason we always recommend tweezers, we always go back to tweezers. They're easy to find. And those tick scoops can be really difficult to use if you have a tick in a belly button in the fold of an ear. It's much more difficult to use a scoop like that and get underneath the tick. So they're a tool. They may have their time and place, but those tweezers work for every situation, every type of tick, every life stage, and wherever it is on your body. So we always say it's the best tool for the job.
Hands up, more questions on the room? Right, yeah, go to the right, and then we'll go to Zoom and front row again.
Hi, Christine Herb again. I would like to know how does Lyme and other tick-borne diseases rate in public health concern in New York State? My sense is that we are not giving it enough attention.
Well, I'm going to say that because it's what I do. So I'm going to say I agree with you, but you're right. And it is certainly a concern in New York State. In fact, we just had, we're finishing a report now. We had a New York State Tick-Borne Disease Working Group formed with recommendations that are being provided to the governor's office on how we can better address tick-borne diseases. And also a lot of our focus lately has been not that Lyme is not of concern, but we're working a lot to say it's not just Lyme, because a lot of what we're hearing is that folks are not aware of the other tick-borne diseases that are occurring in New York State. And obviously it's something we're thinking about as New York State public health professionals when we're thinking about moving forward in the advent of an era when we'll have a Lyme vaccine available. Because, you know, clearly folks who are interested in preventing Lyme disease may get that vaccine, which is obviously an appropriate choice. But in New York State, we're going to have to stress that all of those personal prevention messages we've been talking about will still apply. And we don't want folks to get complacent and so, oh, I had the vaccine now, I'm not going to worry about using repellent. I'm not going to worry if I have a tick bite anymore. And in New York State, those things are obviously of great concern. So, you know, we certainly have high case numbers for Lyme disease. One of the reasons that we were very on board with this idea of a new case definition is so we weren't spending all of our time in public health trying to track down each individual case of Lyme, but instead being able to do more to monitor tick-borne diseases like Lyme in the population of ticks, and be able to do more in the way of prevention messaging and things like that than just spending all of our time trying to count cases, when we truly believe we can still look at trends over time by looking at Lyme testing patterns. And in fact, seeing the rise in cases that we're seeing with the new case definition, we've known Lyme was underreported for a very long time. And even with the new case definition, it will continue to be. Again, if we're only looking at serology, we're missing folks that are diagnosed clinically. And that's on the onus is on the provider to report those. And we know not every healthcare provider is doing that. So when we know it will still be an underestimate, we feel like it will definitely lend credence to the problem of Lyme disease by showing many more case numbers than we have in the past.
Let's go to the Zoom community up there. Tina, if you get a mic to him, we got a couple questions that come in and off from our Zoom participants.
All right, so from Megan Bradshaw, she's an MPH student at UNC Chapel Hill. The CDC recently reported on suspected alpha-gal syndrome cases, and this emerging condition seems to be impacting Long Island. What is the state doing to improve prevention, detection, and response strategies to alpha-gal specifically?
So it's a good question, and I know the presenter coming after me will be speaking about alpha-gal, so I won't spend too much time on it. But I will say that at the moment, it's not a notifiable condition in New York State. So we are relying very much on sort of these extra efforts to be able to get information from commercial laboratories that have done testing. So we have some of a handle, but we don't have the clinical information piece that goes along with it. So I'll say it's sort of a gap in our surveillance knowledge. But that being said, we have certainly seen in the Suffolk County area in particular, we've worked closely with them, and they are doing a lot to sort of improve or add this to their body of information on why you should prevent a tick bite, right? You want to eat a burger, you should be preventing a tick bite, you know, and in some ways I say it tongue in cheek, but we mean it, because these prevention messages that get sort of stale over time, convincing folks that tick bites are dangerous can get stale over time. Folks know it. So it's a good way to sort of refresh messaging and try to reinforce that preventing tick bites is important. And we never know what new disease, what new condition may be around the corner when it comes to ticks.
Something else from Zoom land, or is that it for now? Who in the front row had their hand up a moment ago? Yep. Here you go.
Okay. I noticed when we were looking at your data, the maps of New York State, that most of your testing was being done in Hudson Valley area and New York City area. And there was one county way up north that had one testing site over the 5 years. And surprisingly had very low incidence of ticks or tick-borne illnesses. And I'm wondering, is that because there are fewer people there? Why the emphasis on the Hudson River Valley?
So it's more that that's where we tend to see, we still see the bulk of our tick-borne disease cases there. So it's not really, those human surveillance maps are based on where folks get commercial lab testing. It's not testing that we're doing as a state health department. It's where individuals are seeking testing. And again, that's largely through commercial laboratories, but we still do see most of our highest incidence of tick-borne diseases in the Hudson Valley and in the Capital District. And that's true for many of our tick-borne diseases. And, Lyme for a long time was sort of the leading edge with Central New York and Western New York. Now that's true, again, like I said, you can get Lyme in every county in New York State, but many of our tick testing sites do not have quite the same incidence when we're talking about risk, although that is changing over time as well. And your risk is substantial in any county you live in New York State. The same can't be said of things like babesiosis and anaplasmosis, where we still get away from the Hudson Valley region and the Capital region. And as we get to a little bit west of here, we start to find numbers really drop off. We expect it to expand, those other diseases to expand over time in the same way that Lyme disease did.
Probably got time for at least one more question, maybe two. Anybody before lunch? There we go. Not lunch, next presentation.
The other part, I want to commend you for the signs that I do see posted in the parks now about there might be, there are ticks here that might have disease. And that's great. What concerns me is considering how significant this disease is in our state, our healthcare providers need to be educated. They do not have an understanding of this. This is not something that they received in their training. And there's so much to keep up with that it's really up to our state health department to put the word out, like huge campaign. Think about this disease and don't dismiss it. Think about it first, when you're trying to differentiate what this could be. And stop telling patients to throw their tick away. Get them tested.
Okay, is there a question buried in there? We need to move on.
What is being done to promote more education to providers? The CNY Lyme Alliance is doing this annual program, but so much more needs to be done on the state level.
So we do a lot, we do healthcare advisories every year. Now, I will tell you, we do healthcare provider advisories on this and many other topics, right? It is one of many. We have done credit or things for CME credit. We've done things with the State Medical Society. We have done grand rounds. And what's difficult is that, these are advertised, these are well advertised in the community, and we get very few people attending sometimes. So we keep trying to make inroads into different areas. One of the things we're thinking about now is maybe urgent cares. Again, so many people are being seen in urgent care now for things like this, right? Febrile summer illnesses and heading to urgent care. So trying to make inroads with maybe particular specialties might be our path forward. I don't want to be a Debbie Downer on the process. It's been very difficult for us to get large groundswell of individuals coming out to learn when we've tried to do additional activities to try to increase that provider knowledge. So sometimes it's things like palm cards, or it's things like that poster that we can put in provider offices, and then advertising them statewide and through the local community as well. But I know we were short on time, so you can feel free to talk to me after. I'd be happy to talk in more detail.
Yeah, Jennifer, you're sticking around for lunch. Ann, you got something to say? Go ahead.
Yeah. Ann Messenger with Central New York Lyme and Tick-Borne Disease Alliance. Jennifer, I don't know if you caught the buzz that ran around the room with people looking at each other and texting when we saw your poster of the rashes on different colored skin, not exclusively white skin. Accommodations.
Yeah.
Thank you
All credit
much.
to CDC, but we did choose to rebrand and provide to prepare in large, we have thousands and thousands and thousands in of our warehouse. Please ask us for them. This is how, things like this is how I get that word out. We do let our local health departments know, we do let medical societies know, but getting that word to frontline providers is really hard. Please order them. We'll make more, but we can't make more till we run out of what we have. So we're proud of it, and we're proud of the work we did with CDC to get that done.
And Jennifer, you will be around during the lunch
Yep.
hour for more questions. Great.
Yep.
Jennifer White, thank you from State Health.